I want to start this morning with just talking about some good news before we get to less good news. Vaccinations. The great news today is that our doses for the first dose, the population 16 and above, have now reached almost 50%. So that's a very positive step forward. And for those who are fully vaccinated, we're up to about almost 22%. And we're going up at about 5% a week. So can I just say to everybody out there, we're not going to beat this virus unless you all get on the journey with us. And we need you all to book in for vaccinations. You can do it through your GP, you can do it through your pharmacist, you can come to one of the state hubs. We need you to do that because that's our freedom path. Vaccination is our freedom path. Tomorrow, Sunday, at Sydney Olympic Park, there will be a special day, effectively a big day out for the food providers of Sydney. If you're involved in any aspect of that, if you're selling food, if you're to check out counters in a shop that is providing Sydney with food, you can make a booking to go tomorrow to Sydney Olympic Park to get vaccinated. We've already got 1,000 people booked in, but there's another 4,000 vacancies. So jump on the Service New South Wales, or actually jump on nsw.gov.au. That'd make it easy. nsw.gov.au this afternoon. They're just putting that connection up there for you. So sometime this afternoon, maybe after about 2 or 3, hop on that web address and you'll be able to make a booking. Also, I want to emphasise this week, of course, is the big week for HSC students at Kudos Stadium. All the parents and students would have received the link sent out yesterday. Don't waste time. This is your big chance. This is your chance for gold, as I said yesterday, to go and get vaccinated. There's Pfizer vaccine available there. Good vaccine, good opportunities. AstraZeneca's available, Pfizer's available in our various venues. Plenty of vaccine. So go and get vaccinated. But for the young people, this is a really big opportunity to get it. It's dedicated to you for the week. So respond to the link. There was a link in the letter that came out to you. So make sure you or your mum and dad get onto the link and make the booking. It's essential you have a booking because we don't want everybody arriving at the one time. We want you all to have a really good experience, similar to what occurs in our other hubs. So make the booking and get yourselves out there. Try and arrive not too early, not too late. I think the letter that went out to you all said arrive about half an hour. I would stress get there half an hour, but no earlier because that will just increase the queues. But don't get there any later either, or you might miss your booking. I also just want to stress that where we go in this situation is in the hands of the community. The government and our health staff and the police and the ADF can only do so much. In the end, this is in the hands of every one of us as community members as to when and how we get out of this rather troubled time with COVID. So I just want to stress that and suggest to everybody that they do need to get on the journey in terms of the vaccinations, but also to recognise that there are some sites that we know are continuing to be problems. We know there are essential workers going out, and of course they have to work to keep us all with our particularly our food and so on, our essential items. But what we're seeing continually, and a lot in southwest Sydney and western Sydney, and I'll have Dr. McAnulty say a bit about Canterbury Bankstown in a little while, we're seeing people go to work and forget the COVID rules that are there. So, as Dr. Chant has said on a number of occasions, one of the regular ones is everybody behaves well out in the shop, but then they go back to have a cup of tea out the back and they're all close together, and before we know it, we have, as we did with KFC, I think it was yesterday, more than a dozen cases. So we really need to remind all of the smaller businesses to do the right thing and follow the COVID-safe plan. The reason you're allowed to operate is you have a COVID-safe plan, but you've actually got to comply with the COVID-safe plan. And if you don't do that, then we will continue to have these escalating numbers of cases, particularly in southwest and western Sydney. I also just want to say that on that theme of people having it in their own hands, I think it's time that people woke up to the fact that we're not just asking people to not go and visit other households. You're not expected to go to a party. You're not expected to go to a gathering. That is absolutely not what you're supposed to be doing. And of course, we've seen the cases up in Newcastle that it appears there might be connections with what's now happening in Armidale, and I'll address that in a moment. We need to make sure that we stay at home. It's a pretty simple rule. Stay at home. Don't go out. Unless you need to go out once a day to get your shopping, don't go out. Stay at home. And that is the biggest thing you can do for all of us and for yourself to make sure that we beat this Delta virus that is wreaking havoc across the world. If you don't want it to wreak havoc in our community, then just stay at home. It's a pretty simple message. Now, the tests. We had 108,449 tests to 8 p.m. last night. I want to thank the community. I mean, the community coming out for those tests is essential for our health team to be able to know what's going on with this virus. So thank you. I remember when we were talking about hoping we'd get up to 40,000. So the Sydney community, the New South Wales community, is doing a great job on that front. But the not so good news, to 8 p.m. last night, we had 319 locally acquired cases. 319. We had 2 international travellers. Of that 319 locally acquired cases, 125 have been identified already as linked to previous cases. 108 are contacts of households, so they're already, we know we can work through those connections. 17 are close contacts of previously known cases, but 194 are still under investigation. And obviously that presents challenges for our health staff. That's why I'm saying to the community, you've really got to get serious about staying at home. You can't leave our health staff continually to be having to search where you've been, what you've been doing. It's not fair to the community, it's not fair to yourself, it's not fair to anybody. I'll leave it to Dr. McAnulty, if that's all right, to let us know about how many people are in hospital, how many people are in intensive care. I do want to stress again the location of today's main cases are in southwest Sydney. In that local health district there's 112, and in Western Sydney at local health district there was 98. I want to emphasise that this disease, because people go and visit other households when they shouldn't, and for a variety of other reasons, but that seems to be the essential reason, and for the workplace issues that I've already discussed, we constantly see the potential for cases to creep out of those 8 LGAs. And what we are seeing now is moving into that area just west of the Blacktown area and into the Nepean area, we're seeing new cases. So at 8 p.m. last night, we saw 23 new cases just in that area. And from the advice I've had this morning, we expect there'll be more tomorrow. So I would just say to the residents in that area, you need to go and get tested. If you have any symptoms at all, be on high alert. We really want to stop the transmission in that area before it goes further. I want to stress to the families, particularly who are, I believe, probably still visiting each other, going from one household to another, you can't do it. You might think you're outside the LGA boundary, or maybe you're not thinking about it at all, but you cannot go and visit other households. And I particularly want to just put people on notice as to where the cases are, the 23 from last night. The cases were in Colleton, Erskine Park, Kingswood, St Clair, St Mary's, North St Mary's, Ropes Crossing, Penrith, and of course my advice to the community in that general area, as with the broader Sydney area, indeed across New South Wales, if you have any symptoms at all, go and get tested. I also just have to advise, unfortunately, that there are, at this stage, 2 cases in the Armidale area. Those came in again, concerningly, late last night, and the Armidale Regional LGA, or local government area, which includes the major city of Armidale, that's about 25,000 people. Gaia is about 3,500 to 4,000 people. And of course, there are some smaller towns. on the advice of our public health unit and Dr. Chant's team, that city, that area, that LGA, Armidale LGA, will have to be put into a lockdown, and that will occur from 5 p.m. today. It'll proceed for 1 week to allow the health team to get a handle on what other cases might have been transmitted as a result of a particular young person going into that area and apparently transmitting it to somebody else. Our health team is going to be working on that. I'm sorry to the people of the Armidale local regional council area, but I would say to you, this is being made as a caring concern, out of caring concern for your area. Whilst it's going to kick in at 5 o'clock this afternoon, I'd also say to you, if I were living in that area, I would be actually not going out of my house today. I would be staying at home. I wouldn't be visiting friends, and I'd be making sure that I protect myself and my family. Of course, it will be the same arrangements as applies in the Newcastle area, which is effectively the Greater Sydney lockdown area. And on that note, I think I've covered. Oh, I might leave it to Dr. McIntyre to cover the unfortunateness. There have been some more deaths, sadly, and I think Dr. McIntyre can talk about those. But I just want to say to each of the families, I can't imagine how you're feeling, but my condolences and the government's condolences to each and every one of you on the passing of your family members who've been caught up in this terrible COVID situation. Dr. McIntyre.